You know, technology can do a lot of things, but it really can't replace the human connection. She describes her music as coming from the dark night of the soul, that from the depths of depression, she rediscovered the power of her music. She reminds me of the words of Frederick Douglass, "If there is no struggle, there is no progress." Douglass said that those unwilling to agitate for freedom want crops without plowing up the ground, rain without thunder and lightning, and the ocean without the roar of its waters. But I know every one of you out there are not afraid of a little thunder and lightning. You aren't afraid to plow the ground and listen to the ocean's roar. Because of each and every one of you, we are here today and for the next 3 days to honor your struggles and to celebrate our progress. In 2006, we gathered in Orlando at the Renaissance Hotel for the National Council's 36th annual conference. There were about 1,000 of us, and we filled the hotel to capacity. The awards of excellence were announced, but we had no celebration. And my greeting to you, and some of you may have been there, consisted of saying hello and reading a short list of sponsors. What a difference 10 years makes. This year, we're in one of a handful of hotels that can hold a conference of 5,000 in a city that has not one but 2 zip lines, a high roller Ferris wheel, which I see right outside my window, and a volcano that explodes on demand. The awards of excellence will be celebrated with a concert, and because of your hard work, I have a lot to say. What a difference 10 years makes. It certainly made a difference in the national dialogue about mental health and addictions. I'm going to walk over here, and I'm going to want you to watch a short film clip. Please watch.
We need a revolution in mental health.
Mental illness is a real disease.
A lot of mental health leads to addiction because people self-medicate.
Addiction needs to be, it's a lifetime challenge.
This is a disease. It's not a moral failing.
Because the pain's real. The mental illness is real. In some cases, addiction's already there.
In fact, every year, roughly 1 in 5 adults, or more than 40 million Americans, experience a diagnosable mental health condition like depression or anxiety.
Mental health, that's a serious issue that we could work on. Republicans and Democrats alike believe this.
We have to stop judging and start giving them the tools they need to get better.
People feel as though the issue of mental illness is something that happens to somebody else.
My husband Frank and I buried a child to drug addiction.
My daughter has addiction problems and is in recovery now.
We need more treatment, we need more facilities, we need more support.
Hello everyone, it's such a pleasure to join you by video for NatCon 16. I want to start by thanking all of you for the outstanding work you do every day to bring relief to those who are suffering and to serve as a safe haven for those facing mental illnesses and addictions. At a time when tens of millions of Americans of all ages and backgrounds have a diagnosable mental health condition, your work is vitally important and urgently needed.
Politicians of every persuasion are talking about addictions and mental illness, and even the First Lady of the United States is finally thanking you for what you do. What a difference 10 years makes. 10 years ago, you might have laughed me off the stage if I had said that the first African-American president would pass and the Supreme Court, with its first Latina justice, would twice uphold the most sweeping health reform of our lifetime. Today, the Affordable Care Act and parity are the law of the land. Today, the Office of National Drug Control Policy is led by a man in recovery, and Michael Botticelli will be with us today. Together, we have struggled to make progress, and the momentum is with us. Last month, the Senate Judiciary Committee passed the Comprehensive Addictions and Recovery Act, and we expect the full Senate and House to do the same. It's a start, and we're grateful, but you know what? Grants are not enough. If you had cancer, you'd get chemotherapy. If I had a blocked artery, I'd get a stent. It wouldn't depend upon a grant, and it shouldn't for us. We are in it for the long haul. Lack of progress is not an option. It wasn't an option for a young 24-year-old woman who went to McKinley Hall in Springfield, Ohio, in desperate need of residential treatment. She was 4 months pregnant and addicted to heroin. When she got there, there was, of course, a waiting list. When her name finally came to the top of the list, the staff couldn't find her. By the time they found her, the baby she was carrying was dead. She delivered the next day and buried that baby 3 days later. If we are truly committed to all children, to keeping them home, in school, and out of trouble, the most effective intervention we have is to treat their addicted parents. Ray Tomasi, the CEO of Gosnold and a National Council Visionary Award winner, tells us that in his home state, 87% of the people admitted to a detox unit have been there before. He warns that the real problem is the absence of community-based ongoing care. In other words, short-term solutions are not enough. We need ongoing treatment and recovery supports in every community, and we need insurance to pay the bill. Like addictions, mental health issues have unprecedented visibility. Yet members in Congress are really not in lockstep with one another. They're as polarized as much of this country appears to be. They have differing opinions on some very hot-button issues. Should Medicaid beds be expanded? Does protecting a patient's privacy diminish their family's capacity to help them? Is it mental illness, or could it be guns? But 10 years has made a difference. 10 years ago, we had to educate our leaders about why mental illnesses and addictions matter. Today, we have to educate them about what matters in addressing mental illnesses and addictions. And you know what? We know what matters. It matters that we detect early signs of psychotic illness and deliver first episode services. It matters that we add cognitive therapies and medication-assisted treatment to the holy grail of 12-step programs. It matters that we adopt measurement-based care. I know my numbers for my blood pressure, my lipids, my weight. I get them monitored, and now we must do the same for behavioral health. And what matters most of all is that we grow services and housing, not jails and prisons. We've learned that our commitment to what is our deeply held values of giving to the public still matters. But now we also understand that innovation, strategy, and leadership skills are critical to the delivery of healthcare in the 21st century. These are not incompatible ideals, and that's the difference 10 years makes. We thought we had to choose, but we don't. Think about this. 10 years ago, I would have used my flip phone to call my travel agent, and I would have taken a cab to the airport, right? Today, I use my smartphone, and I summon my Uber driver. Well, guess what? We will not be a yellow cab in an Uber world. Changes in healthcare means we have to be smart businessmen and women and caring clinicians. They are not incompatible. To paraphrase Kristen Woodlock, a National Council consultant, health and human services have operated as agents of government for 50 years. Now that healthcare is becoming a retail market with value-based purchasing, we need to become what she calls a millennial not-for-profit, a not-for-profit that balances passion with business savvy. And you know what? Savvy business people understand that managed care, hospitals, FQHCs, and private equity are all interested in our customers. Now, 10 years ago, we would have called them competitors. But you know now, increasingly, you are calling them partners. That is amazing. And although you might operate with slim margins and struggle to find capital, they know you bring something very special to the table. Think about the travel agents that have survived. You know, picking a flight is easy. But as I've just experienced, booking an extended tour for family members that live all over the country, not so much. People quickly really get overwhelmed, and they turn to the experts like you. Now, my travel agent may use the same technology I have at my fingertips, but they go an extra mile. They offer experience and expertise. They listen to us. They help us sort out what is it we really are looking for, and then they help us get it. Technology revolutionizes how we do things, but it doesn't replace human relationships or human connections. And relationships and connections are what we are all about. Charles Darwin said, it's not the strongest of the species that survive, it's not the most intelligent, but it's the most responsive to change. And you are very adept at weathering storms and adjusting to changing trends. Without the benefit of rounds of capital, you are some of the most innovative organizations in this country, private and not-for-profit. Organizations, yes, clap for yourselves. I do believe that. Organizations like the Mental Health Center of Denver, where they're both advancing their business and paying attention to the social determinants of health. And you're going to be hearing a lot about the social determinants of health, both here at this conference and I think generally. We know that only 10% of our health is determined by the care we get. What truly determines our health is really our environment and our habits. Where we live, how much money we make, where we go to school, what we eat, what we do like smoke, and what we don't do like exercise. The Mental Health Center of Denver considered these determinants when it needed to expand. It had bought some property several years ago for a clinic in a mostly Latino and African American neighborhood. They had to spend and wanted to spend 3 years planning with their new neighbors. And they crafted a vision that went beyond the traditional behavioral health space. A vision that includes early childhood education, pediatric dentistry, a gym and classes ranging from art to Zumba, a 1-acre urban farm that grows carrots and potatoes, and an aquaponic tanks to grow tilapia and catfish. After all, they knew it's hard to talk to people when they're hungry. But the new center in Denver is a business. It's organized, detailed, analytical, and built on a research-driven business plan. But its sense of humanity is inescapable when you hear the giggles of preschoolers on the playground. You see their eyes grow wide as they look into the massive fish tanks. and you see a grateful mom happy to have fresh produce for her family. In Denver, they weren't afraid to face change, something that's a constant in our lives. But what doesn't change is how we feel about the work we do. Our progress is tangible, and it's even more so when it can be demonstrated with data. 10 years ago, all I thought about were units of service. Now, we're measuring the health of populations. Angus Deaton, last year's Nobel laureate in economics, crunched some big data, and he discovered something that certainly surprised me. I think also shocked a lot of people, may have surprised you. He discovered that mortality rates for white middle-aged men and women with no more than a high school education were skyrocketing. And the reasons? Drugs, alcohol, and suicide. He didn't mince words. He said 500,000 people are dying and are dead who should not be. But you know what? We're not Nobel laureates. But we don't have to be to use data to save lives. 10 years ago, the Missouri Coalition began to use data to try to improve the prescribing practices for kids that were taking antipsychotics. They're the show me state, and show us they did, with a 68% drop in non-evidence-based prescribing and savings of $120 million. All right, Missouri. These kind of numbers get attention in Jefferson City, Missouri, and on Capitol Hill. And it's progress, you know what, worth celebrating. So tomorrow night, Brent McGinty, the CEO of the coalition, will get an Award of Excellence. I think it's important that you celebrate what you do. Our momentum has continued because of leaders in Missouri, in Massachusetts, in Denver, and right here in this room. Visionary leaders like the National Council's board. Would Susan Blue, our chair, and the members of our board please stand? I just want you to be recognized for the progress you've helped us make. You know, every once in a while I get a new assistant because they get promoted, is what happens. And every one of them gets to know the board. And they just have two things to say, the smartest people and the nicest people. I can't think of a better compliment. I'm equally proud of my partnership with the extraordinary Jeannie Campbell, our executive vice president, our CEO, and the guru of healthcare's biggest and best behavioral healthcare conference. I don't know if Jeannie's in the room. And you can spot the best staff I've ever had the good fortune to work with by their trademark National Council blue scarves. They'll help you with anything you need over the next 3 days. If you're smart and you need directions and you see me, you'll go the other way and you'll look for one of them. Jeannie and I have seen the change that 10 years can make. Our staff grew from 12 to 95. Our membership grew from 700 organizations to 2,700. But you know, change is a very, very funny thing. It can be exhilarating, like a good thunderstorm, but it can also be scary. And you're seeing this play out on the national stage. We have marriage equality, transgender rights, and an increasingly diverse population. Yet some would have us close our borders and turn inward. We're unlocking the secrets of the brain and talking about addictions and mental health from church halls to the halls of Congress. Yet some would bring back asylums and deny individual freedoms. We've put in place real solutions: population health, integrated care, certified community behavioral health clinics, and isn't that a mouthful? Yet some are turning a blind eye to the increasing disparities between the haves and the have-nots in this country. Over the last 10 years, I certainly have come to understand, as I think you have, that race, class, and privilege are at the heart of health disparities. That poverty, untreated trauma, and being viewed as less than equal exact lifelong consequences. Chronic health conditions, mental illnesses, addictions, suicide, and mass incarceration. The white middle class that are dying too soon are not alone. There is a 13-year gap in the mortality between top and bottom earners in this country, and it is growing every year. This disparity is the next frontier of talking about health disparities. A lifelong resident of Flint, Michigan, whose largely poor African-American community was reassured their water was safe to drink. She told an NPR reporter that she feels expendable. Well, no one in this country should feel expendable in 2016. Because of our struggles and our progress, we have an unprecedented opportunity to help people at the margins. And over the last 10 years, you've developed the tools to do that. Chase Brexton is a health center, and it's one of hundreds of organizations that have worked with the National Council in our trauma initiatives. Many of the children and adults they serve live in poverty, have repeated exposure to trauma, and have poorly managed chronic disorders. Dr. Winston Wang from Kaiser Permanente, who funds this project, he believes the project widespread could save billions of dollars. But you know what? He knows that we're saving more than dollars. What we're doing is far more important. We're saving untold human suffering, and you cannot measure that in dollars and cents. Conversations about differences can be very uncomfortable, and tomorrow, the Atlantic's Steve Clemons will help us confront some issues that are very difficult for us here in this room. Does cultural competency really improve the quality of care, or does it divert practitioners from the science of care? Do issues of social justice belong at the core of medicine? And does 42 CFR protect patients, or has it become a barrier to better care? Over the last 10 years, we've not been afraid to tackle difficult issues that led to difficult conversations. They've galvanized us, and I think they've resulted in a change in how the National Council and all of our members are viewed in Washington. 10 years ago, the press didn't call us. Actually, when I got to DC, I learned that some in the behavioral health community blamed our members for a system they called in shambles. And we hadn't put forward a legislative idea in 20 years. 10 years later, just last week, we talked to CNN, NPR, and the Washington Post. 10 years ago, the National Council held our first Hill Day. We had 35 people, and we were excited about that. This past year, Hill Day had 700 attendees, 10 partner organizations, 300 meetings on the Hill, and we tweeted Hill Day messages until we reached 73 million impressions. You know, Twitter wasn't even around 10 years ago. Hashtag progress. I got it right? But nothing shortcuts the hard work that goes into legislative change. Let's take a look at the Excellence in Mental Health Act. 2 years ago, I was on a stage like this, and we were celebrating the passage of an 8-state demo. Well, last month, Senators Blunt and Stabenow introduced a bill to expand that act to 24 states, not 8. And you know what? Your advocacy can make that bill a reality. Certified community behavioral health clinics will expand access, offer immediate treatment, and coordinate care. CCBHCs are the alternative to streets and to jails and emergency rooms. 24 states are planning their participation, but under current law, only 8 can play. Congress needs to give every state working to change care the ability to do so. We have a rallying cry, yes. We have a rallying cry, and I want you to join in with me, okay? Fund the 24. Fund the 24. Once more. Fund the 24. We can make it happen. I know we can. And while we're working to expand resources for treatment, let's not forget the impact each of us can have every day. 10 years ago, if I was studying first aid, I would have learned how to check a pulse, clear an airway, and perform CPR. I might save a life. Today, as a certified mental health first aider, I would recognize that the despondent-looking woman standing on the edge of the subway platform needed help. I'd be able to call for assistance while I waited with her and kept her calm. I might save a life. More than 500,000 Americans, 540,000 Americans to be precise, have taken this life-saving program. More than 500,000 people, police officers and correction officers, teachers, bus drivers, faith leaders, parents, even First Lady Michelle Obama. And you know what? It's because of you. I don't think people out there know that you were the original mental health first aid champions. We wouldn't have 500,000 people trained if it weren't for you. Our next goal, 1 million. That's why we launched the Be 1 in a Million campaign. You've seen some of the signs outside. But again, I need your help. If you've not taken a mental health first aid course, will you commit right here, right now, to become certified? If I can count on you, say yes. Yes. Got it. Now, if you already offer trainings in your community, and many of you do, will you commit to offering at least 3 more this year? If I can count on you, shout out yes. Yes. Whoa! And if you run a business, I'm not letting those vendors or managed care companies off the hook. If you run a business, will you commit to training your staff? If we can count on you, shout out yes. Yes. Woo! Excellent, excellent. I love it. I love it. Just, you are really the best. And 10 years after the first time I welcomed you to a National Council conference, and 10 years after introducing Hill Day, we are celebrating our hard-won progress, but we are far from finished. As President Obama said on the 50th anniversary of the Selma March, to deny our progress would be to rob us of our own agency, our capacity, our responsibility. But he went on to warn that the march is not yet over, the race is not yet won, change depends upon our actions. If we make an effort, no matter how hard it sometimes seems, laws can be passed and consciousnesses can be stirred. Well, you know what? We can and do make the effort. We can and do get laws passed. And together we can be sure that whoever stands on this stage 10 years from now can say loud and proud what a difference 10 years can make. Thank you very much.